And Susan, are you noticing that women are being included in the research so far, both as facilitators and participants?
It's a great question to ask on a day that honors the Indigenous populations in Canada. Today is the National Day for Truth and Reconciliation. And, you know, we have to do better in policy to shape the regulatory and scientific infrastructure in order to honor what nature has given us. And this includes cultural and gender equity. And any research that's being properly conducted now, it's required to have equal participation, including gender and ethnic diversity. There's policy at the NIH that includes the women in clinical research, and it ensures sex as a biological variable is included in all study designs, analysis, and research, which also includes, it's really interesting, it also includes animal research. And they have a mantra to consider, collect, characterize, and communicate all sex-based outcomes. And also, I'll say this again, there needs to be more women in STEM. There's amazing female researchers in the psychedelic space. However, you can see by the advisory boards of some of the companies today that have presented that it's an entirely male-dominated space. The market for psychedelics is new, it's exciting, but it's also being exploited by people without proper policy or licensing or facilities.
And I'll add to that, actually, Susan. Our company actually just went public on the Canadian Securities Exchange. So it is, yeah, super exciting. But I'm the only female in that space. I feel like I'm the only female I've really kind of talked to in that space. So I think it's going to be an integrative aspect of females learning the business model, understanding that stuff, and then learning how do we speak the language of the business people in the psychedelic space of the as it grows, per se, with the business aspects, because I feel like it's businessmen who see this as a huge opportunity to make money. And yes, thank God something came, because, you know, the last 50 years we've been stuck in the mental health space. But this is going to be a huge opportunity for so many people. And it's going to be a great, great time for people, females, minorities, everyone across the board should be coming together to try to help their individual classes as well, because we all are a little bit different. We all metabolize medications differently and such. And that's something that we all need to really, really consider. But definitely, you know, being a CEO of a company, it's only about 5% of females that are in this space. So there's a lot of opportunity for growth here, tons of opportunities. And then our bar's so low, you know, in the mental health world with the medications that we have, they still can't prove that those medications are better than a placebo. And that's really insulting. So, you know, it's almost trying to say in the mental health space, if we didn't give them anything, would we have better outcomes? So that's kind of the exciting thing about MDMA and psilocybin, LSD, all these guys, ketamine especially, you know, because it's more real time right now, is we have a huge jump that needs to be made, and it's, you know, it's wide open right now. So if you are a female on this, I would say get educated, step up, and recognize when you go into a space, when you go speak to a crowd, while we want to be recognized as strong females, we are still very much a minority. And when we walk in, you know, don't demand respect, but just expect you're going to earn their respect because you do know that much more than they do, or you are that much more comprehensive. So, yeah, I just wanted to add that to Susan's piece there.